Let us move on to the hearing with Unite, a group of parliamentarians who work in line with the targets of the United Nations, and I'd like to give them the best welcome from us. They are represented by Mr. Riccardo Battista Leite, who is a founding member of Unite. I'd like to give him the floor immediately so that he can contribute to our work. You have the floor, President. Prova tu.
Hello, good afternoon. We're wondering whether you can hear us from the booth here at the Italian Parliament. Wait a second. Oh, you can? Oh, wonderful. That's great.
Can you hear me? Because there's two of us. Can you hear me as well, please? Yes. Thank you very much. Thank you.
Prego, a lei la parola.
So you have the floor. Thank you.
Thank you, Chair, and good afternoon to all the members at the Italian Parliament. It is a true honor to be able to speak to you. My name is Riccardo Battista Leite. I am the founder and president of the Unite Parliamentarians Network for Global Health. I will just share my presentation that I hope you can all. Just one second. Can you all see my presentation?
Sì, grazie. Vediamo.
Yes, we can. Thank you.
Thank you. So as I was saying, my name is Riccardo Battista Leite, and I founded the Unite Parliamentarians Network in 2017. As you will see, we are a network of current and former members of parliaments, congresses, and senates, now from 116 countries around the world. My background is as a medical doctor trained in infectious diseases. Having worked many years as a medical doctor, I then was elected a member of parliament myself in Portugal. I served 4 terms. I was also involved in local government as a deputy mayor and a city councillor. And today I share my position as a volunteer president of the Unite Network, along with my day job as CEO of Health AI, which is the global agency for responsible artificial intelligence in health, nonprofit based in Geneva. So as I was saying, we were very honored as the Unite Network to be able to speak to you and to reflect upon the Mattei report and the work that your country is doing in the space of international development for Africa, that we highly value and consider to be a critical priority for the attainment of the Sustainable Development Goals. As a network of current and former legislators from more than 116 countries, we work in collaboration precisely to promote science-based and evidence-based policy making. The core 3 pillars of our work are around equitable access to health and human rights, the strengthening of health systems, and global health architecture and security. And we do this not only working with legislators, but also bringing together civil society movements, international organizations, academia, private sector, and the affected communities. We are a network that has a board, which is composed of members of parliaments from different countries and regions around the world. So we've divided the world into 10 chapters. Each chapter chair, along with myself, formed a non-executive board. And then we have a secretariat that is based in 5 countries around the world, headquartered in Lisbon. But we have offices from Argentina to Ghana, Georgia, the country, Morocco, among others. We work on through multiple tools, if you will, towards achieving our goals of mobilizing political will towards transformation for better health outcomes for citizens across the globe, be it through capacity strengthening of key stakeholders, promoting roundtables, policy briefs, and also our flagship event, which is the Unite Global Summit that brings together parliamentarians from around the world to discuss these matters. Just last year in October, we organized the Unite Summit in Berlin on the sidelines of the World Health Summit, bringing together parliamentarians from more than 50 countries. And we work in collaboration with the World Health Organizations, with whom we are an official partner. We have proposed, having reflected upon the draft report that you were kind enough to share with us, we were able to propose some areas of intervention and collaboration that we consider that the Italian Parliament and governments can consider precisely moving forward as areas to potentially invest further in. These include, and I will start with an area that we consider to be still critical. If you look at SDG target 3.3, which is HIV prevention, diagnosis, and treatment. There are 2 actions here that we consider critical. I remind you that the SDG target is to end the epidemic of AIDS, tuberculosis, malaria, and neglected tropical disease. I also remind you that we are very far behind. If we look at all the SDGs in general, according to the Secretary General of the United Nations, we've only hit 17% of the targets, and we already have passed 50% of the time to reach them. So the first action we are proposing for HIV is to leverage, through your investments, community-based health initiatives that could include mobile health units and digital support tools to provide HIV testing and treatment in rural and underserved areas. This is critical to ensure that antiretroviral treatments reach those that need them the most, so that not only that we can treat people who are living with HIV and AIDS, but also as using treatment as a prevention to avoid further dissemination of the virus within the communities, which we continue to see among the highest death rates in Africa. The second action is to expand capacity strengthening programs for healthcare professionals and community health workers in the region. This, of course, would include key areas like HIV treatment protocols, prevention methods, early diagnosis, and a huge opportunity we see for once and for all to end mother-to-child transmission. We have the knowledge, we have the technology. There is no reason for a woman who is living with HIV to transmit that virus to their unborn child. And it still continues to happen at scale on the continent of Africa.
Presidente, mi scuso, ma devo...
Excuse me, President, I have to interrupt you to specify and try and describe our objectives today here. We basically are trying to understand what you think of the Mattei plan according to your hands-on experience, and what suggestions you have for the Mattei plan. And there's another contribution. No, that's it. Thank you.
Well, I was precisely presenting key actions that within the Mattei plan Unite has identified as key areas of intervention that we believe as part of the international development efforts within the African continent that could be endorsed by the Mattei plan. And that was the understanding that we had gotten with this invitation. My apologies if we were not aligned.
No, davvero la ringrazio.
No, of course, I'd like to thank you very much. At this point, maybe we can listen to my colleagues' questions so that we can direct the conversation somehow. I don't know whether some of my colleagues would like to take the floor. Onorevole Quartarelle.
Grazie. Thank you very much. I would like to thank you, Dr. Leite. And actually, in other circumstances, we discussed the Unite initiative in the past, which I think is very useful in order to think about the engagement, the commitment of parliaments regarding specific targets related to sustainable development in relation specifically to healthcare. Perhaps what could help us perhaps to link together the Unite initiatives with the Mattei plan would be on the one hand focusing specifically on Africa. The initiatives that work, that Unite sponsors and that actually work in Africa, and also how we can perhaps cooperate both bilaterally between, let's say, Italy and African countries, as I was saying, bilaterally. So what are the recommendations that Unite might provide to make sure that this relationship can work between Italy and African countries in terms of ownership in this domain, therefore providing us with hints on how the Mattei plan might work? And I don't know whether you have any suggestions also on how instead to make sure that cooperation between donor countries might work in this field, because the Mattei plan is not simply an Italian plan involving Africa, but this is an Italian plan that's open to cooperation with other countries and organizations, once again involving Africa. Thank you. And I would like to give you the floor, Doctor.
Well, thank you very much, Honorable Member, for the kind question. It's towards the Unite Network. Say that we are engaged through parliamentarian leadership to make sure that in each country, when there are international interventions and when we are requested by, for example, a government that is investing in terms of international development on specific programs, as the Mattei plan is doing already, and I was going to address some of those further down the presentation, we are willing and capable of mobilizing political support on the ground. As you know, especially after COVID within the African continent, there has been an uprise of certain levels of rejection of international support within countries. Country leaders have somehow, and civil society movements have manifested some concern that this undermines their sovereign interests, if you will. What we believe is that it is critical to rebuild that trust. When you spend Italian citizens' tax money within the African continent, you want to make sure it's accepted positively and that it has the greatest impact possible. For that to happen, we believe that it is critical to create that kind of coalition of the willing within each of the countries that you consider priority. So going directly to your question, I would say that more than happy to collaborate directly within the Mattei plan, in the sense of ensuring that in the countries that you decide as priorities, to try to build the support towards them. Moreover, we be a global platform. We can identify other countries that are investing in similar countries or in areas of intervention, so that we can maximize the impact of those of that funding that is being used for certain fields. And the areas of interventions that we've been particularly involved in, including, for example, at the institutional level, for example, at the Africa CDC, with the idea of increasing health emergency preparedness and response, especially after COVID-19. It is clear that the Africa Center for Disease Control and African institutions are far from ready, be it in terms of local manufacturing of vaccines, be it in terms of preparedness and response to potential health threats, being able to prevent future pandemics. that there's a lot of work that needs to be done, and this demands multilateral collaboration. Another huge area that we've identified as of critical in nature that we can support, and we're doing work in several countries, is in the field of digital health and artificial intelligence, where we see this is probably one of the areas with investment that a plan like the Mattei plan can actually allocate resources to help countries in the African continent to leapfrog, particularly in rural areas that don't have access to health, making sure that you're not replicating some of the mistakes we've made in the Western world in terms of being over-dependent on healthcare workers, but using the power of technology to make sure that in communities far from hospitals and clinics, that people can have access to the health and care they need. And so it is precisely building up those coalition of political will, along with civil society, local media, and so forth, that unite, can work with you within the Mattei plan to make your plans more impactful and create the coalitions with other countries and other initiatives and other philanthropic initiatives in the region to achieve your goals.
Thank you. Honorable Billy would like to ask another question. Thank you. I will be concise, considering that time is fleeting. I was wondering whether, based on your experience, if it is possible to define priorities regarding possible actions to be put in place, or perhaps geographically. So what are the priority actions in priority geographical areas that you identify in Africa? For instance, also in order to develop and improve and fine-tune the roadmap that we are developing for this. Thank you.
Prego, Presidente. Vedo che si è collegata.
I'm sorry, I apologize. I see that the Honorable Honori has joined us online. She organized this hearing, so if she would like to make any comment or ask questions, we are asking her to let us know. So if you could please answer the question. Thank you.
So,
mi fa segno l'onorevole Honori.
No, but we will give you the floor immediately. No, sorry, Honorable Honori would like to make a comment. Thank you, Chair, and I would like to also welcome you all and our speaker. I would like to emphasize, and this is the reason why I scheduled this hearing, I would like to focus on two connections. First, the connections between, let's say, healthcare, the healthcare conditions, situation, and the possibility to find adequate care for people, and the decisions that the people make to leave their country. So the importance of healthcare that sometimes act as a trigger for migration flows. And then the importance of an adequate healthcare network to promote genuine development, real development, as a driver or as a prerequisite for economic development, which then might happen through the different agreements, the different initiatives that are put in place, the different investments that Italy might make in an African country. So these are the two kind of angles that we would like you to discuss. Thank you. We would like to give you the floor at this point.
Well, thank you very much to both Honorable Bilay and Honorable Honori, and thank you in particular to Honorable Honori for in putting together this hearing. To answer Honorable Bilay's question around priority regions, I think to give a very honest answer there, this would depend very much on the areas of intervention that you would consider to be priority. What I mean by this is that, for example, within the Mattei program, you already have invested in Morocco, for example, on a model for remote monitoring to reduce hospital admissions and improve patient outcomes. This is an amazing program that it could be easily expanded to other African countries. And so building up on an investment you already have made. But that being said, it is our assessment that for this to be impactful, you would have to select very carefully the countries that have at the level of maturity of their health systems to benefit the most. It's not the same to work in the Moroccan environment as it would be to work in Tanzania or in Ghana or in South Africa. And that's an assessment that certainly, once again, the Unite Network would be happy to collaborate. But I may add also, beyond the priority areas and priority countries, that it's important to do an epidemiological approach, in the sense of if there are key areas, let's imagine that you decide that, and this would be part of our suggestions, which is there has been a tendency to ignore cardiovascular, respiratory, and metabolic diseases like obesity and diabetes in Africa, as seen as secondary priorities to infectious diseases. But these are growing concerns within the continent that will have tremendous negative impact in the future if they are not addressed today. To understand where the epidemiological burden is greatest is critical so that your impact of your investment can be the most. The other thing I would like to say on this point is the importance of foundational investments. What I mean by this is that sometimes we focus on key projects, but that in certain countries, but it's also important to build robust African institutions. The African Union, the Africa CDC, all of these organizations are still nascent. They're very early stage in terms of their development. They will be critical to ensure some level of harmony of interventions on the continent of Africa, to ensure the quality of health and care and development, and building up strong, robust governance institutions, I believe, is a critical aspect of the work that needs to be done that is only possible with funding. And that, once again, should not be done by one single country, but it is an opportunity through the Mattei Plan to bring in other partners in other countries to invest in building institutional robustness in the region. And I couldn't agree more with Honorable Honore in the sense that health is clearly one of the prerequisites for international development. No country can develop economically, can grow economically, if it does not have the basic health and well-being of its population at the core. If you have a population that is dying, and especially in Africa where there's such a huge young population, if that young population is not addressed from a health perspective early on, the consequences are going to be devastating. And if we think, for example, from a health security perspective and migration perspective, which Italy has been a tremendous victim over the last decades, the truth is if we do not address these issues head on in Africa, we will see over the next decades a rise of those migration waves. And so I think the Mattei plan is actually a huge opportunity even from a national security perspective, and putting health at the center is a very important way towards promoting that development and economic growth that would also keep those populations in their own countries to be able to contribute to that economic development.
Grazie mille davvero.
Thank you very much, President, for your contribution. This cycle of informal hearings is now concluded.
Thank you.